My name is Mariana Machaen, and thank you so much for allowing me this opportunity to apply to SDSU'S Marriage Family Therapy program. The first thing I want to talk about is what am I most passionate about for being a mental health provider. Having been through the mental health system, I understand the importance of resolving psychological turmoil, and I want to help others through that. Right now, I am working as a recovery coach for Crestwood San Diego, where I get to support patients as they learn to live independently and become resilient in the face of their mental illness. I have a resident who feels that she is unfixable and is struggling to be compassionate with herself. She felt this way because she has been within mental health facilities for so long, and she felt that this meant she wasn't changing. I proceeded to collaborate with her by creating a visual of her accomplishments inside residentials, identifying interventions that worked for her recovery goals, and creating weekly plans to help her accomplish her realistic and tangible goals. Through these interventions, the resident was able to feel uplifted and express looking forward to completing her goals. This kind of work has been incredibly meaningful to me. These residents have been stuck in the mental health system for years, yet I'm able to help them and see what they can still heal and improve. Ultimately, I want to have a greater impact by delving into their traumas and offering long-term interventions to help them resolve their psychological turmoil. Being an MFT would allow me to do just that. The next thing I want to talk about is what exactly do I want to learn in SDSU's Marriage Family Therapy program. Fundamentally, I want to become a competent entry-level MFT. From this program in particular, there are 3 skills I really want to learn and develop: cultural sensitivity, substance abuse support, and trauma-informed care. Firstly, I really appreciate this program's emphasis on multiculturalism because of my own experience with the mental health system. I've had therapists in the past that did not acknowledge how my mixed Mexican-Iraqi upbringing, my gender, or socioeconomic status factored into my mental health. I noticed this disregard for these factors reduced the quality of my care in many ways. For example, after sharing about a family argument, one of my therapists failed to acknowledge how important family values are within Mexican and Iraqi culture after telling me to just disconnect from my family and saying, "It's that easy." As a mental health professional, I want to be more culturally sensitive provider and avoid making the same mistakes. Secondly, I want to learn about how to support people who have gone through substance abuse. As a mental health provider, I have been exposed to many people who have or are going through substance abuse and understand how common dual diagnosis is. For instance, in my current position as a recovery coach, there are many residents that are trying to stay clean while wanting to improve their mental health. A lot of the time, I'm able to connect and coach with the residents through their experience with their mental illness. However, I have never had enough training to support others with substance abuse, so I frequently need to disclose to them that I am not trained for that and instead refer them to a rehab specialist. My experience in my current position has shown me that I need to gain more knowledge and practical experience with substance abuse so that I can further support and connect with people who have dual diagnosis. Lastly, I want to develop the ability to better provide trauma-informed care. I can see that trauma is very pervasive in this field, and it's a really hard thing to deal with for both patients and providers. For example, I'm currently working with a 64-year-old woman as a recovery coach at Crestwood San Diego, who frequently shares with me her past trauma while she was in a religious cult. When I first heard her share her trauma, it pained me to hear her experiences, yet I made sure she knew I was listening and thanked her for trusting me with her trauma. After, I was informed by my program director to instead redirect her with other conversation topics when she shared her trauma. I listened to my program director and continued to follow the resident's treatment plan, yet I still wished I could have the training and the credentials to help her with processing her trauma. Experiences like that really showed me that I'm supposed to become an MFT, and I need the extensive training to become one. The thing I want to talk about is what do I imagine at this time will be my contribution to working with others to provide them with helpful mental health services. So far, I've been able to contribute to patients' healing in the jobs I've worked with by being a patient and perceptive mental health professional. When I was a case manager, I worked with a non-binary teenage client who felt untreatable due to multiple case managers refusing to work with them for more than a week. As we communicated about what I could do to help mitigate those feelings, we came to the topic of career goals. In our sessions, I made sure to take an interest in their interests and learned as much as I could about them. After a few sessions, I noticed that the client was very good with their hands. They were into hairstyling, crocheting, and solving physical puzzles like Rubik's Cubes. I identified the strength of theirs, and that affirmation of their strength and value immediately piqued their interest. We worked together to find some possible career paths for them. They seemed particularly interested in becoming a hairdresser or a seamstress. Not only was I able to identify this person's strengths and reaffirm their value, I was able to remain this patient's case manager for 7 months, far longer than any previous case manager. While these skills have been incredibly useful at my previous positions, I want to put them to greater use as an MFT. I think that when I become a certified MFT, I would excel at creating a safe, comfortable, uplifting spaces for therapy patients. I think I would be really good at collaborating with patients and identifying the interventions that work for them. And I think my past experience with the mental health system would allow me to relate to patients in a really unique way. Thank you so much for this opportunity to apply to the MFT program at SDSU. And whoever is reviewing my application, I hope you have a really wonderful day. And again, thank you so much for this opportunity. Goodbye.